The government is under pressure to limit harm from measles as it spreads to vulnerable Pacific Islands countries. In Samoa, an outbreak was declared after a toddler died in Apia's hospital of suspected measles. Now the virus has reached Tonga too. Meyer reports.
Last night, Tonga's government officially declared a measles outbreak. Its Public Health Chief Medical Officer, Dr Reinald Ofanoa, said the kingdom had 68 confirmed cases as of Wednesday. He said contact tracing revealed the spread had come directly from New Zealand.
Majorities of the cases that we had initially were members of a national rugby team, players who visited New Zealand from our schools, who visited New Zealand to play some games during the month of September. And then the first case contracted the disease while in New Zealand.
Dr Ofanoa says Tonga is fortunate to have previously achieved herd immunity to measles with over 95% vaccination rates. He's confident this will lessen the severity of measles for Tongans. But he urges the public to check immunisation status and get jabs prior to travel. Meanwhile, in Samoa, the government issued a release this week.
To date, we've been notified of 169 suspected measles cases since September, with 153 in Opolu and 16 reported from Savaii. Of the total, 7 have been confirmed for measles last week. In addition, we have 83 specimen results pending and 1 suspected measles-related death.
Speaking from Apia, after the measles-related death of the toddler last week, the Deputy Director-General of Public Health, Dr Robert Thompson, called on New Zealand to step up.
If the outbreak in New Zealand is not under control anytime soon, then we will still continue to see a prolong with the measles outbreak here. Because now, because of the travelling public, so many Samoans coming from there to here and so many coming from here to there.
Pressure on the New Zealand government to help its Pacific neighbours address the growing viral outbreaks was also underscored by the Opposition Associate Health Spokesperson, Dr Shane Retty.
If it came from a New Zealand outbreak, I think we have some responsibility to them and we should be collaborating and helping as much as we can. It's a consequence of a government that removed health targets. It's a consequence of a government that missed the multiple warning signs that we were due for an outbreak, and here we are today with nearly 1,800 cases of measles, and now we're exporting it as well. Simply not good enough.
New Zealand's Ministry of Foreign Affairs and Trade responded, saying the government has reached out to Samoan officials offering advice and practical assistance. A spokesperson says the government has been working with UNICEF across Pacific Island countries to ensure the availability of vaccines, while a group of New Zealand nurses have been in Samoa delivering training. RNZ asked Foreign Minister Winston Peters how concerned he is about measles spreading into the Pacific.
Look, we are very concerned about it. Of course, we're very keen to help out, whether it be Samoa or Tonga.
So should more have been done to ensure that people vaccinated? Only at about 30% they had children dying. Should more have been done?
I'm not going to criticise Samoa, but you realise 2 people died last year and they suspended immunisation programs back then.
So this is on them?
I mean, those pointing when the people have been dead and loss of people's lives, to start pointing the finger. We stand ready to help if they want us to.
Meanwhile, across New Zealand so far, 2019 has seen 1,928 confirmed cases of measles notified, and 1,554 of these people are in the Auckland region. The ministry has moved to vaccinate more babies, boosting herd immunity, and advises parents of babies aged 6 to 11 months living outside Auckland to talk to their GP about vaccinating at least 2 weeks before travelling to Auckland. For Checkpoint, this is Jenny Meyer.